A little bit of background about myself. So I have about 27 years total here at Loma Linda, and a good portion of those years, about 20 or so, has been in oncology. I spent 8 years in bone marrow transplant as a financial coordinator and transitioned over to research, doing clinical trials as a regulatory coordinator. So as you are working on your submissions for IRB of your projects, I have a lot of experience in that, and we will get into talking a little bit more about that, and I'll be a good resource for you when you get to that point. This presentation is kind of a two-part presentation, so I'm basically going to start out just giving you the history of why we have an IRB and how all of that works. Once we get beyond that, we'll get more talking into what it is entailed in your IRB submission and how that works. So to get started, so the IRB we're basically a committee that ensures adherence to all federal, state, local, and institutional regulations. This is all concerning protection of human subjects in research. So we're responsible for not only institutional policies and ethical philosophy, but state regulations regarding human research. And as we know, there's a lot of different regulations within the state of California than there is for other states. And then we have federal regulations regarding human research. That includes the OHRP and the FDA. And so in a nutshell, we're basically a committee that protects the rights and the welfare of human subjects research. So research with human subjects has had a long and often troubled history within the US and throughout the world. And many of these abuses have led to the creation of the codes that are followed within Europe and here within the US. And these regulations we follow to protect people in research today. And this all came about after a series of events in which doctors and scientists abused the trust and the society placed in them, not only internationally, but here within the US. So we have the German Nazi medical war crimes, and these medical experiments were done by physicians and scientists, and this affected many prisoners within concentration camps. Many of these medical experiments included injecting people with gasoline, live viruses, immersing them in ice water, and forcing people to ingest poisons, which resulted in their death. All of this led to the Nuremberg trials, and most of this happened without these prisoners being consented and being involved in these medical experiments. Within these 13 Nuremberg trials, the first one, there were 23 doctors who were indicted. 16 of these doctors were found guilty, and 7 received the death penalty. So the lack of these international standards on research with human participants is what led to the Nuremberg Code. That code is represented by 10 different points, and the primary point is voluntary consent is absolutely essential. Then we had the study that took place here in the US, and that was a syphilis study that was in Tuscany, Alabama. This study actually lasted for about 40 years. And it began as an initiative to document the natural history of syphilis without treatment. So within this project, they recruited about 600 subjects. Out of those 600, there were about 400 of them that did not even have that had the disease, and 200 that did not. So they were not told much about the study. They were not given any consent, any informed consent to participate. And not only that, but when there became an effective treatment for these subjects, they were not even informed about this treatment. They weren't given the treatment, and they actually were even prevented from even finding out and accessing that treatment. So the National Research Act of 1974 was passed, and this was basically driven by the publicity that was given on the syphilis study. That National Research Act is what created the National Commissions for Protection of Human Subjects of Biomedical and Behavioral Research. If you've not done your human subjects research here on campus yet, you will be doing one that's specific to this topic. And this is to identify the basic ethical principles that should underline the conduct of biomedical and behavioral research involving human participants, and to develop guidelines which should be followed to assure that such research is conducted in accordance with those principles. So very, very important to know all of this information. And when you're doing that training, really want to pay attention to everything that they're teaching you in there that will help drive your IRB submissions. And that commission basically drafted the Belmont Report. This is a foundational document for the ethics of human participant research here in the United States. And the principles of the Belmont Report govern all research that is supported by U.S. government. And these ethical principles outlined in the report, they're the basics for subsequent regulations designed to ensure the protection of human subjects in research. That includes the DHHS and the FDA, who published their regulations based off the Belmont Report in 1981. And the Belmont Report has basically become the gold standard for human subject research here in the U.S. So there are three basic principles that are wrapped up in the Belmont Report. So there's respect for persons, beneficence, and justice. So with respect for persons, this is basically, we want to make sure that you're obtaining and you're documenting informed consent. As you can see with those prior studies that had taken place without consent, you can see how important it is to have that in place. And then making sure to respect the privacy interests of your research participants. And then considering additional protections when conducting research with a vulnerable population. Then you have beneficence. So this one uses procedures that are present, the use of procedures that present the least risk to participants consistent with answering the scientific question. Gathering data from procedures that are already being performed for standard of care that you wouldn't be doing necessarily specific to that research study is actually going to prevent additional risk for those subjects. And then you have risk to subjects that could be reasonable in relation to both potential benefits to that participant and most importantly, to the knowledge expected to result from your clinical trial. And then maintaining that promise of confidentiality for those subjects. And then monitoring the data to ensure the safety of your participants. So basically, this is boiled down to two general rules: is first, do no harm, and second, maximize possible benefits and minimize your risks. Then we have justice. You want to be sure that your studies have an equitable selection of subjects and that you're treating people fairly. Whatever you're going to do for one, you're going to do for all. And then fair sharing of burdens and benefits of the research. As an injustice can occur is when benefits to a person is entitled are denied without good reason or when burdens are imposed unduly. So this is basically where it comes down to the reasoning and the backing as to why the IRB is considered the nitpicking IRB. So we nitpick for good reasons. We're trying to make sure that your study is following federal, state, local, institutional regulations. We're here to make sure that we're protecting the institution, and we're here to make sure that we're protecting the subject. So your human subjects, they deserve that protection. And being that they're coming here to Loma Linda, which is a very known institution, well known for doing research, they don't expect anything less from us than to make sure that we're going to be protecting them while they participate in that trial here. And one mismanaged study can potentially shut down research across the entire Loma Linda enterprise. Now, there are potential consequences of a mismanaged study. So we have actually had here on campus where a department is working with a sponsored initiated study, and they did not follow the protocol as written or as IRB approved, and that can trigger protocol violations. But this became an ongoing issue, and that sponsor actually threatened to no longer do future research, not only with the PI, but within that department and within the institution. So this isn't something that is just hypothetical. It has actually occurred here on campus. This could also lead to a for-cause audit by the FDA if you are doing a clinical trial that includes FDA drugs and devices. And so not only can they come out and do that audit, they may audit the department, the clinic, the hospital, or the IRB. And then there could be additional consequences to an actual PI. The FDA can actually disqualify an investigator, which means they're no longer eligible to receive investigational drug, biologics, or devices. and are not eligible to conduct any clinical investigation that supports an application for research or a marketing permit for products regulated by the FDA. And then the IRB. So who is IRB? We are basically required to have a minimum of 5 members on our IRB. Those 5 members need to at least include a non-scientific member, scientific member, non-affiliated or community member. We need to have a diverse membership. And any studies that are FDA regulated involving drug and devices, we require a physician to be present. However, here at Loma Linda, we have about 23 IRB community members right now, and we have some of those are primary, some of them are alternates. That does include pharmacy, we have pastors, we have pathology, we have nursing. So we have a big variety of people, some who have medical backgrounds experience, some who do not, many who have degrees, and some who do not. So keeping that in mind when you're doing your protocols, you want to make sure that they're written in a easy format to understand for any of the IRB reviewers who are reviewing that study for you. And then basically, this is a human subjects research study. It has to be made up of 2 different definitions. Your study has to meet both of these definitions. So one of them is research and the other one is human subjects. You can't have one without having both in order for the IRB to have oversight of that study. So in determining whether your study is going to meet that definition as research, it needs to be a systemic investigation, including research development, testing, and evaluation, designed to develop or contribute to generalizable knowledge. With that being said, as you're doing your protocol and your IRB application, there's going to be a section for you to include what are the benefits of your study. We're looking to see what is the benefit to your subject and what is the benefit to society. There may not be a benefit to your subject, and that is okay. You just need to let us know that, but we need to at least have a benefit to society, or it won't qualify as a human subjects research study. And then you also have to make sure that it's a human subject, meets the human subjects definition. That means it has to be a living individual, not somebody who is deceased. And it has to be about an investigator conducting research obtains data through intervention or interaction with that individual, or identifiable private information or biospecimens. So as you can see below on here, if it meets research only, it's not going to be considered human subject research. If it meets your human subject only, again, it's not going to be human subject research. It has to be both for us to have any involvement and have oversight of that study. Now, if you still are unsure whether it is going to meet that category, then we always suggest that you submit a determination request to the IRB. This is done electronically. This is our IRB website you would go to, and these slides will be shared with everybody so you don't have to write everything down. Once you submit this application, it's very simple. There's just a few things that you have to provide. There is a 1 to 2 day turnaround time. The other thing that we do suggest, again, even if you are not sure, you think maybe this is not human subjects research, but you might be considering publishing your results later down the road. A lot of your publishers are actually going to ask you for official IRB determination that your study was not human subjects research. So it is good for you to still go ahead and go through this process. Then there are 3 different levels of IRB review. The first one is full board. This is our conveyed IRB review. This is our IRB committee that we had talked about, the 5 or more committee members. Typically, when we have a study come through full board, we assign 2 IRB reviewers. However, everybody on that committee actually gives their input on the studies. Then we have expedited. And when we say expedited, everybody thinks that that is a quick process, but actually it's a category. It's not a timeline. And then we have exempt. So exempt means that the IRB is not going to have additional oversight. However, we have to make that determination that your study is exempt first. And then just to break this down a little bit more of what types of studies fall into these 3 IRB review categories. So your full board is typically going to be greater than minimal risk. That would basically include anything that is a randomized study, that is FDA regulated, including drugs and devices. And if this causes any pain, injury, or death to a subject, then it more than likely this is going to be considered greater than minimal risk and need to go to our full board. Now, if you have a study that is minimal risk, it will most likely go to expedited review. However, we have specific categories that your study has to meet within that expedited requirement. If your study doesn't meet those expectations, it can actually get bumped up to a full board review, even though it's still minimal risk. For example, if you are collecting blood samples, there are specific requirements for what type of subject, whether they have an illness or they're healthy or if they're minors, on how much you can collect, how often you can collect. And if it doesn't fall into that required category, then it gets bumped up to a full board review, and it can still remain as minimal risk though. And then you have your minimal risk exempt, which these are typically going to be like your anonymous survey studies or secondary research that you are collecting identifiable data or biospecimens. And then submitting to the IRB. Cannot stress to you enough that make sure that before you begin to do anything in a clinical study project, whatever you're working on, you must have IRB approval first. We do not give retrospective IRB review or approval. So we have had students that have not graduated on time because they had submitted their study to the IRB and they were thinking, okay, the study's in review, it's being worked on. In the meantime, I'm going to go ahead and start getting in touch with some potential subjects, see if they're willing to participate in my trial. I'm going to start collecting some data. Once I get that IRB approval, I'm ready to go. Well, what happened is you're not allowed to do any of that without IRB approval. So because that happened without approval, those subjects were no longer eligible to participate in that study, and that data was no longer allowed to be used. So they had to start all over from ground zero. So make sure to submit to us first. And then once you're getting your projects going, determine what type of study you're going to do. So you may have an anonymous survey, you may have a retrospective chart review by itself, or you may combine your study and do retrospective and prospective. If you're doing that combination, it's considered a minimal risk. And then you have a clinical trial, which is usually like your FDA regulated trials. And the reason I say deciding on what type of study you're going to do is there are specific documents to do to those specific studies. So we don't want you to be doing an anonymous survey, but you're actually filling out all the clinical trial documents because you're going to be doing a lot of extra work that's not necessary. And then things to consider outside of that is how long is it going to take you to do your study? So are you going to have enough time to complete that study in order to graduate? That means going through the IRB review process, collecting your data, doing your data analysis. One of the things to consider too is when you are submitting to us, trust me, we really want to be able to review that study one time and get it back to you and have you ready to go. However, many of times we have to request for multiple corrections to be made, and we'll talk more in depth on that in a little bit. And then considering the cost. So there's different types of costs that you may have involved in your study. It may be if you have an interventional study, you may have cost to that. If you're doing interviews, focus groups where you're recording, if you are doing in-person, you may have a cost for the device that you're using for your recording. If you are enrolling Spanish-speaking subjects, you're going to need to have translated documents. There's going to be another cost, or if you're doing compensation for your subjects. So just to take all of those things into consideration. And then considering the subject population. So if you are enrolling minors, then you need to consider not only that you may have to, that you're going to need a parent or the legal guardian's consent as well. But depending on the type of study, the length of study, and the age group that you are enrolling, there's a possibility that those minors are going to turn age 18 while in participating in that study, whom are going to have to be reconsented. So there's a lot of different things to take into consideration. And if you have somebody that's a diminished, maybe they have a dementia, And so you've gotten consent, but you may also have to look at getting a legally authorized representative to consent on that study for them as well. And so in preparing for that IRB submission, we really suggest that you go to the IRB toolkit. And this is the link here. And again, we'll get this information to you. But on this website, we have multiple templates for you, and we'll go into those into depth. But I just wanted you to be aware that this website's here, and you can access templates that will give you all kinds of information and help walk you through the steps. So when you're collecting your documents, prepare for your submission, the first thing you want to have is your protocol. I can't stress enough how important it is to start with the protocol first, have a final draft of that before you move forward with the additional documents, especially for the students who are doing projects and you're doing it with multiple students. One of our number one issues, and you will hear me talk about it quite often during this presentation, but our number one delay in IRB is inconsistencies. I've been in this role for 3 years now. I've only had one study in 3 years that came through to us with no inconsistencies. So that's why I stress that point. If you have a final protocol, hold your information from that protocol to plug into your other documents. Many a times what we see is we have one student working on the protocol, one on the IRB application, one on the consent, and they're working on them separately. And then all three of these documents have different information. That leaves the IRB reviewer not knowing which information is actually accurate. And this could be as simple as dates. It could be as simple as one word in a protocol title. Now we don't know what title to put on your approval letter. So just those little tiny things to make a difference. In having a HIPAA authorization, if you're collecting and recording personal health information and personal identifiers, you're going to want to obtain a HIPAA auth from your subjects. If you have a study that meets the definition of a medical experiment, then you may need to provide them with a California Experimental Subjects Bill of Rights as well. And then anything that you have that you're using for recruitment materials, that could be text messages, emails, flyers, any of that needs to come to the IRB for review and approval. Same thing with anything that's going to go to a subject. So if you're going to talk to a subject on the phone, we need a verbal script of what that conversation is going to be, which we actually have a template for. If you're going to hand any documents to that subject, it could be a medication diary, a brochure, that needs to come to us. Anything that they're going to view, if you are going to have them view a 2-minute, 5-minute video about something, then ask them to do a survey to follow, we need to have access to that video as well. So anything that is given to a subject that they see, hear, or view, that has to come to us first. And then if you're a student doing a project, you need to have a PI for your study, but that PI must have a faculty appointment in order to qualify as a principal investigator. Now, one of the things that we do not have on the IRB website is going to be a template for designing a flyer. So I have put this together so that everybody can reference this if you get to that point. The one thing I will cover through this is compensation. So if you are going to have compensation for your study and put this on your flyer, you have to make sure that it's not standing out above anything else within that flyer. So all of the font needs to be the same color, the same size, the same style, to be aware of that. And then you can always add your QR codes and your links. And then tips for recruitment. This is one of the other things that we get that a lot of people are not aware of and can cause delays in their submissions is if you are going to be recruiting employees and students here at Loma Linda, researchers are not allowed to send out emails for recruitment purposes. So what you would have to do is either ask the dean of the medicine department or a department administrator if they're willing to do that on your behalf. And in that process, you would need to provide either a letter of support from them agreeing to do so or an email that they agree to do so. And you need to submit that with your IRB submission packet to us. We need to see that they are in agreement with that. And a lot of people aren't aware of that, so we have to take that back to them. It takes more time to get that. So if you can do that ahead of time, that'll help prevent some additional delays for you. And then again, if you are only enrolling employees and students, you cannot post flyers on Canvas. However, if you have a situation where you're employing, or enrolling maybe the children of an employee, then that would be a possibility of being allowed to be posted, but not just enrolling those two categories. And then if you are going to be doing you're asking somebody outside to do recruitment for you. So you're asking another facility, will they recruit their patients or their students? You don't need to have a letter of support provided to us. However, you do need to get agreements from them that they're willing to do that. But if you are going to do research activities, you're going to utilize space on their facility property. That is a point where you would need to provide us with a letter of support. We need to know that they are okay with you doing research activities on their premises. And then recruitment via social media. That's become a real popular one lately. And that is okay as long as you have confirmed that these are platforms that are approved by Loma Linda. And so in order to, I would suggest that you make sure that those platforms are approved first, and then make sure that in your documentation to us that you clarify that you're going to be only recruiting from social media platforms that are Loma Linda approved. Otherwise, we will be coming back to ask you to confirm that information. Compensation. If you are going to do a drawing or a raffle, you just need to understand that California has a lottery law that you have to follow. And what that is basically if you're going to offer it, you have to offer it to anybody who wants to join in that lottery, or excuse me, in that drawing or that raffle, regardless of whether they want to participate in your study or not. And that has to be clearly explained within the informed consent documents. Also, when you're doing compensation, explain how that payment is going to be dispersed. So are the subjects going to get their reimbursement at the end of each visit? Is it going to be at the end of the study? And how are you going to be paying them? Are you going to, give them a gift card? Is it going to be a gift card handed in person, or is it going to be electronic? Secondary research. So this would be where you have identifiable private information about specimens, and this may be exempt if the information is publicly available or the information is recorded by the investigator in such a manner that the resulting data contains no information that can identify subjects directly or through identifiers linked to the subject, and that the investigators confirm that they are not going to go back and try to re-identify these subjects. So in this case, there would be no informed consent required. And again, these exemptions have to be determined by the IRB. For anonymous surveys, so if you're doing this, as I had mentioned previously, we have specific documents for this type of a study. So there is a specific protocol template, there's a protocol template that you want to use to be non-clinical for this one. There's a specific IRB application, which is about a 3-page application versus a 5 to a 9-page one. That's why I said you don't want to have to do the long one. You want to do the short one. And then informed consent, there's actually a 1-page informed consent that is basically pre-populated. You just fill in the blanks to be specific to your study. And then making sure that you provide the survey as well. You'd be surprised how many of these come through to us and we're actually missing the survey. So we don't have a complete packet to review. And then make sure that you provide the link or the QR code that's going to include that consent and that survey. And again, having all of your recruitment materials or anything that you're going to provide to that subject. So you want to have a full, complete packet when you go to submit to us. If you're doing research internationally, this is something that it's going to go through local IRB. We will approve it. However, we do require that you either can obtain a IRB equivalent in that country agreements that you can do that study there. If they don't have their own IRB, then we basically ask that you get a letter of support obtained from local experts or community leaders to ensure that they are supporting your project there. And then submitting to the IRB. So One of the other most important things you want to do is make sure that whoever's going to participate in that clinical trial with you, that you're going to be adding to the IRB application, make sure that they've all completed their human subjects research education, their conflict of interest training, and their significant financial disclosure form. If one person listed on there does not have all of that completed, that study won't get assigned an IRB reviewer. It gets stuck into a hold queue, and you will get notified. And the PI will be notified. However, you just don't want to have that cause additional delays in your study. So it's just good to make sure that all of that's done ahead of time. So that would include either biomedical basic or social behavioral basic and good clinical practice training, which is good for 3 years. And then your conflict of interest training is good for 4 years. Your SFI disclosures, these will be done annually unless you have a change in your finances, and you're going to want to update that at that time. If you have any questions when you go to do your city training, Jerry Mendeville, our research compliance manager, and Sandra Pride, our research compliance analyst, are the best contacts to reach out to for help. And depending on whether you're working on your education portion of it or your COI portion, this would be the email addresses that you want to use to reach out to them for help. If you're just trying to get login and you're having issues with that for your significant financial interest disclosure, you can reach out to the help desk. Now, I do have a set of slides in here that will walk you through all the steps for doing your city training. I won't go into those ones specifically. I'll leave those for you to go back to later. I just put those together that you have as a reference. So the IRB pre-review process. So basically, once you submit your study to us, the first thing we want to do is we're going to go through that packet to make sure that everything is there. All the documents that should be with that submission are present. If not, it's going to get bounced back to you. Secondly, we're going to make sure is everybody listed on your study completed all their training we talked about. If not, again, it gets stopped. If you have met both of these 2 criteria, you'll receive an acknowledgement email from us, and we will give you an assigned IRB number with some instructions. Any future email correspondence you have with us, we highly suggest that you put the PI's last name and the IRB number in the subject line so that we can reference immediately to what study that pertains to. And IRB will, at that point, will assign an IRB reviewer for your study, or if it's a full board clinical trial, it'll get put on the next full board agenda. So please be aware, expedited exempt studies, these actually are reviewed on a first come, first serve basis. We get multiple on a daily basis. There are times we have been known to get 20 brand new studies come in one day. So everybody wants their studies in right away. So the best service that we can provide is to do them on a first come, first serve basis. Getting an idea of what is these IRB reviewers looking for. So we're basically looking to make sure that the risks to subjects are minimized. So we want you to identify what are the risks potentially for these subjects and how are you going to minimize those risks to them. And that these risks are reasonable in relation to the anticipated benefits, making sure that your selection of subjects is equitable, and that informed consent is sought from each subject and is appropriately documented. So we'll talk a little bit more at the end about the informed consent, because I want to go into that one a little bit more in depth. But that, like we talked about with the Nuremberg Code, is one of the most important things is getting your informed consent and having it very clear for the subjects. The researcher has adequate training and does not have a conflict of interest. So we were talking about that disclosure form. If you have somebody within the study that has a conflict of interest, say you're doing a sponsor-initiated trial and they have financial interest with that sponsor, then we need to put together a management plan, and we may need to add additional language to the informed consent to notify the subjects about it. So those types of things will come up that each person will be discussed individually on those topics. And then you want to make sure that the privacy and confidentiality of the subject is protected. And you want to make sure that you have additional safeguards included for the vulnerable populations. Another thing too is if you are dealing with subjects that their risks may potentially be emotional, you might want to provide additional resources for them to reach out to if that is needed. And you would want to provide that in the form consent document. And then making sure that the research methodology is reasonable and will accomplish the purpose of the study. So we talked about the training, and like I said, sometimes I'll be a parrot to repeat some things that are very common and come up all the time. So I just want to make sure that I get that through everybody. You guys think about that. Be the first thing you think about as you're preparing your submission. Informed consent. So you really want to make sure that you have the grammar, the spelling, the formatting is done very well through there. If you have a subject who's reading an informed consent and they're seeing spelling errors and mistakes, they're going to wonder and second guess, should I really participate in the study if they're making errors here? How is my treatment going to be on the study? So we want to really make sure that everything is in order. Make sure it's easy to read. Make sure that all the elements are there. Now, if you are using the templates that we provide, all of our templates have specific elements in there that are required. That's either federal regulated, state, or institutional that need to be there. So as long as you're following those templates, you shouldn't be missing any elements. All of those templates also have specific instructions in each element of those documents that will tell you what you need to provide. And then you want to make sure that it's in a 6th to 8th grade reading level and keeping in mind your patient population. So if you are enrolling somebody with a medical background, you're enrolling medical students, nurses, it's okay to use medical terminology. However, if there's somebody who may not have that medical background, be sure that you have it written in layman's terms. And then again, inconsistencies, making sure that everything is consistent. So your consent should also be very consistent with your protocol. However, it should be written for the subject to the subject. And then make sure that you're not missing any of your required documents. So if you are doing your consent and you're collecting PHI, you want to make sure you have your HIPAA, that type of thing. And then lack of details explain all aspects of the study. We have had times where students will submit their protocols to us and we will go through reading it and we're not quite sure as to what they're doing with the study. And so we will call them on the phone and they'll explain it to us on the phone and we're like, oh, okay, that makes great sense. Now we understand. However, what was put in writing and given to us is not what was told to us over the phone. So you really want to make sure that everything is explained so that we have a full understanding, because you know what you're doing. We only know what you're doing by what we read. So if there's details missing, then we're not going to be aware. And so again, that could also trigger us to have additional questions. Again, I'm talking about IRB templates. I stress that a lot because those templates are there. It, like I said, it includes everything that we need, everything we're going to be looking for, and it also just provides you that instruction of what is needed. There may be a time that you come across something in the templates that you feel does not apply to your study, and that's okay. Just either put an NA so we know that you acknowledged it, or pick up the phone and you can ask us, hey, I came across this. I don't think it fits. Can you tell me if it does or doesn't? And we'll help you out so that way you have it done ahead of time and ready to go. And then just double checking everything. Sometimes it's good to just have somebody who maybe doesn't even have a medical background and ask them to read your informed consent and, say, can you go over this? Can you read it? Would you sign up and join my study if you read this consent? Do you understand it? Does it make sense to you? And they can give you that feedback to help get that prepared and ready to come to us so that we can get it back to you as quick as possible. And just keeping in mind, how that's going to, what type of impression is that going to leave on the IRB reviewer who's reviewing it? Are you really serious about doing that study? Or are you just throwing it together real quick and submitting it to us? Because we're not an editing service. We're here to help you succeed, but we need you to get everything in order for us. And then how that's going to leave an impression on your subjects who may see it as well. And again, making sure that those details are clear and concise to anyone who reads it. As I was saying, some people have medical backgrounds on the IRB review board, some do not. And then don't be afraid to contact us. We are here. We want to be a part of that team and helping you succeed in your project. You can always reach out to us at any time. And I'll get down to introducing you to our team here in a bit too. And then one of the things that everybody has big questions on is, what is the turnaround time? So if you're doing a determination request, we had mentioned it's 1 to 2 day working day turnaround time. If you have a minimal risk, it's typically a 3 to 4 weeks, given that that timeline starts from the time an IRB reviewer is assigned to your study. So if you submit your study and somebody doesn't have their training done and it goes into a hold, that timeline has not started yet. It has not started till everything is in place and we get that IRB reviewer assigned. And then once you respond to any revisions that we've asked you to make, then that would be in about another 7 to 10 working days. If you need to make changes to your study, then you'll do what is called a change request, and that is about a 7 working day turnaround. If you're adding, removing, or changing the PI of your study, then you would be doing a personnel change request, and that's about 1 to 3 working days. And just a reminder, the first come, first serve, that does apply to the expedited and exempt. We kind of do that also with our PI responses, with our change requests. However, each one is prioritized into different categories. So it doesn't put you all the way at the bottom of everything. These responses are moved to the back of the line, but reviewed in a timely manner. And then also just keeping in mind, there are times we have people out sick or we have people out on vacation. So even though we've given you these timelines, they could potentially be extended for other circumstances that are outside of our control. And then when you're managing your study, so we talked a little bit about change of personnel. Those are done electronically. A change request form is actually a hard copy document. So anytime you're going to make changes to your study design, if you're going to change your informed consent or your recruitment methods or materials, you want to make sure that you submit a change request to us. And anytime you do that, we need to see a revised protocol. You need to make your changes to the protocol to match. And we always want to see the track changes, and then so that we can see what you're changing, and that will help expedite the review process. And then provide us with clean documents so that if everything's in order, we can stamp it and get it returned right back to you. If you're doing an increase to enrollment, that would be another reason to do a change request. Please keep in mind, if you are IRB approved to enroll 10 subjects, but you enroll 11, not only do you need to submit a change request requesting additional enrollments, but you now have to provide us a protocol violation because you enrolled one that you were not IRB approved to enroll. Protocol violations, adverse events, those are also done electronically. This kind of gives you an information as to how and when you would, for what reasons you would submit a protocol violation. Once your study is completely done, you've completed data analysis and you have nothing more to do on your study, then you want to notify the IRB that you're closing that study out. Keeping in mind, once we close that study, it's done. You cannot go back to recollect data or, maybe get something that got missed. That once it's closed, that's the end of it. And then once you've completely closed the study with the IRB, there are record retention requirements. So basically the minimum is 3 years. If you are collecting PHI, then it's going to be a minimum of 6 years. If you are enrolling minors in that study, then you need to wait for that very last subject enrolled. Once they all turn age 18, then you need to retain for 7 years after that. And then when you get your initial IRB approval from us, you'll have all of the details. That's one thing I do suggest. Sometimes people don't see those initial IRB approval letters. Maybe it goes to a regulatory coordinator or somebody else and the research don't see it. I would always try to get a hold of that and look at it. There's a lot of information that's very important that walks you through how to manage your study. So this is the IRB staff. Deborah Rodman is our IRB analyst. Pretty much she mans our main extension line, and she can answer pretty much most questions. If not, she'll triage them and she'll refer you to the person you need to get in touch with. And then we have Susan Fajardo, our IRB senior analyst. Susan is very good in working on determination requests and retrospective chart reviews. Those are two of the primary things that she focuses on. Myself, and then we have Amy Casey, who's our executive director, and she is also over our compliance department. And just so you know, we actually are 100% remote. So the best way to reach us is going to be via email. We do have 2 IRB email inboxes. This one here is for full board only. So if you have any expedited, exempt, or just correspondence, questions, consults you want to request, you want to use the IRB at llu.edu. This IRB inbox is monitored by all of us. Now, however, if you do email this, you can always CC us on that as well. And then we had talked about including the PI's last name, IRB number in the subject line. That way we just know what study it's referencing. We can get that information right away. If you want to call us, you can reach us at 44531. That line is also, it's primarily monitored by Deborah. If she's not available, it gets forwarded on to another one of us. So we always have somebody who's monitoring that. As you start interacting with me, you'll find that I actually provide my cell number, so I am available that way as well. And then all submissions must be sent via email, since there's nowhere to walk a hard copy to. And just know that at any time that you have additional questions or concerns, you can always send an email to us and ask for consultation. We are available through email, through phone, through Zoom, through Teams, whatever works best with you. We're here to help you, and we want to be a part of that team. This is those city slides I was telling you about. This will walk you through the process of doing your training if you are needing to do that, getting your login, all of that. And again, if you have questions on that, I refer you back to Jerry and Sandra, who can help walk you through that step. So at this point, I'm open for questions. And if I don't have an answer to a question, I would ask if you email it to me, and then I can get back to you at a later date. But other than that, I'd be more than happy to answer any questions you have. And thank you for being here today.
Thank you, Tami. So now we open the forum for questions. Mirai?
Hello. Hi, Tami. How are you?
Good.
I have a question about the employee recruitment. You were talking about the department administrator. Can you tell me a little bit more about it? Because, for example, if I want to recruit nurses, there are a lot of nursing departments. That means I get a approval for every single department directors, or how's that going to work?
Yeah. So if you are doing the recruitment, so do you have is it nursing from different specific doctors, or because what I'm wondering is so you have Patty Radovich, who oversees the nursing, and could she be the one that would be your primary person to recruit for those nursing? I would suggest maybe you could reach out with her. And then that way it would just be one letter of support that you would need from her, and she could help you with that.
Okay, so I don't have to go to each department director to get approval then. Okay,
right.
Perfect. Thank you.
You're welcome.
I saw Lady M. Do you have any questions?
Oh, I was just giving a clapping reaction, but I do see that there's some questions in the chat.
Yeah, I was just looking at that. Okay, so I'll take the first one from Shannon. Are we able to recruit through our own social media platform? You are not. You have to use the Loma Linda platforms. One of the things that I can tell you is if you have a situation where, say, you have posted to a Loma Linda social media platform and that gets shared with somebody else, the biggest thing that we don't want to see is that somebody else outside of that research team is trying to explain a research study. Research studies can only be explained to a participant is by that IRB approved researcher. So we want to make sure that you're your recruitment has a reference phone number, contact, email, someone where once they see that posting, that flyer, that they know who to contact for questions. Nothing can be altered if it gets forwarded. So there are kind of some strict rules on that, but most importantly, to protect the institution, it has to be approved through them. Is there any additional question on that, Shannon, or is? Yes. And then Christina, for HSRE trainings, do we need to provide proof certifications IRB packet? No, you do not. So when you set up your city training, you want to make sure that you're linking it to your Loma Linda email. If you link it to your Loma Linda email, it will automatically link into the system, and it actually talks to our system so we can see immediately whether it's done or not. Now, some people will do training at other institutions, and if you have done training at another institution, just be sure to email Jerry and Sandra your certificate, and they can update it or let you know that it's acceptable, and they can update it for you. But you don't actually have to provide that proof to us.
Lori?
Thank you.
You're welcome.
Hi, thank you so much for the information. My question is really about the determination request form. I'm
Yes.
working with another institution along with my project that is a hospital system, and they have determined that it is not human subjects research. So I do have an IRB letter from them. Should my first step be the determination request form through Loma Linda as well?
Yes.
Okay, and we need to email the IRB office to get the login information to complete that. Is that right?
Yeah, so if you do not have an actual login, username, password for InfoEd, if you email the irb@llu.edu, give us your full name that is on your badge along with your EID number, and then we can get that set up for you right away.
Okay, thank you.
So that was a great question. You're welcome. Any other questions? If you think of something later, please feel free to give me, email me later. Actually, I'll put my email in the chat. And again, you can always send it to the IRB at lu.edu as well.
Mirai, you still have a question?
Yeah, I have another question. Sorry about that. Just want to clarify your, in your slide you have vulnerable population. Do you mean by patients or just want to clarify, make sure? Okay.
Yeah, that's a great question. So that would include if you have somebody who is educationally disadvantaged, if you have somebody who has one of the things I didn't talk about was prisoners can include one. It used to be pregnant women. However, they are no longer considered vulnerable population. And on that note, I'll go back to prisoners in a second. On that note is if you have a study and you're going to exclude the pregnant woman, you need to provide rationale for why you want to exclude them from the study. That is very important. When it comes to prisoners, if they are currently incarcerated, we do not allow them to participate in trials here at Loma Linda. And that's because we're not constituted to review those types of studies. And then that would also include like fetus, embryos, that type of thing. So that's where your vulnerable population would be. So thank you for asking for that clarification.
So I would like to go back to the social media.
Yes.
Just to have it very clear. So we should be able, or it's almost impossible if someone get our flyer and put on their social media. So this is not a problem. The problem would be if that person contact their social media and ask question about a study with someone that has not belong to our study or is not related to our research.
Right.
Is it clear?
Yeah. So, I mean, there's nothing, unfortunately, you can't really control that. So the main thing is we just want to make sure that those flyers have contact person that, you know, if you have questions, this is who you're going to contact for this study. That when it is being forwarded, it's not being altered in any way. And that's where we want to make sure that it is starting out on Loma Linda platform. It's been approved by the IRB and it's in the right spot. We have no control where it goes thereafter. What we don't want to see is that it's starting out on a platform that has not been approved by Loma Linda, because again, we need to protect the institution along with the subjects as well. So that is Loma Linda's requirement.
But most of these will be with QR codes. So sometimes it goes directly, the person entering the study.
Yeah, that's okay.
Yeah.
Yep. Yeah, that's the ultimate goal.
Okay.
Yeah. Yeah. So if you have a link or a QR code, that is actually the best. That way they're just going directly to the information.
Okay. Well, thank you very much. We really appreciate that, and it's very
You're welcome.
informative. And then the question about the slides, I mean, am I allowed to share the slides with the students, or what is
Yes.
Yeah?
Yes, absolutely. Even the one that I sent, the 4-part series one, that one is actually a really good reference. So anybody who is working on an IRB submission, that will give them references of, you know, what things to look for. It kind of goes into more depth of a specific study and what specific documents you may need for that type of study that you're doing. With the informed consents too, it's very important to make sure that you're very transparent with the subjects, really explaining to them how they're going to be involved. What are they going to have to do? How long is it going to entail? One of the things we see sometimes is where they'll say, oh yeah, you're going to be in the study for one day. Well, they don't tell the subject that that one day may be 8-hour day versus an hour. So then what you have is the subject comes in assuming it's 1 hour. They didn't get daycare for a full day, but now when they get there, they're supposed to be the 8 hours. Now they got to withdraw from study. So those are the kind of things that we look for as well. It's just making sure that the consent really explains in detail what they're expected to do when they participate.
Thank you very much.
You're welcome. Thank you for having me.
No more questions. We will adjourn the session then.
All righty. Well, take care and I'll talk to you soon. I'll get back to you on your study.
Thank you. Thank you.
You're welcome. Have a good day, everybody.
Thank you, everyone, for being here.